Hey Internet, Phil here. I had a pretty good day today. Pretty routine at Clatterbridge, really. I went into the executive office there and I was able to request a interview with somebody who can tell me what the future is for Clatterbridge Cancer Centre. And the reason I want to do that is because I'm trying to really push this idea of a cancer moonshot that Joe Biden was talking about 2 months ago, actually now. And I just really, as I was saying in yesterday's vlog, I can't stress how important it is that chemotherapy gets replaced with immunotherapy. And I'm not talking about crap failed things like Avastin. I'm talking about proper immune boosting therapies that are most of them are in phase 3s. There's a lot of data on them on if you look on PubMed, and it's getting to a point now where it's like, just roll it out. Do away with chemotherapy, because it's, in my opinion, it's just no longer fit for purpose. Anyway, I've been having a lot of questions off people who are going through a similar thing as well, or have gone through a similar thing in the past and probably have recurrences and so on. And a lot of the questions I'm getting are based on what supplements I take and the diet, the ketogenic diet, and so on. Now, I'm not an expert at the ketogenic diet. I'm to be honest, I'm very green when it comes to dietary stuff, because my diet before my diagnosis was just awful, really bad, and kind of no wonder that this happened to me. In fact, even on my Skype description, I put Chief Biscuit Tester, and that was what I had as my Skype description at work. But now I'm just going to leave that role to my boss John, and I'm sure he'll be very happy with that. One thing I've been doing though to make sure that I'm doing this ketogenic diet correctly is I've finally been able to get a blood ketone reading, and I use this device, and this is called a on-call GK Dual, so it does both ketones and blood sugar. You just put in some strips in the bottom. You have to prick your finger, unfortunately, and then tap it on the strip, and then you'll get a blood ketone reading. And the blood ketone reading I had, this was the first ever one I had, was 1.5, so I guess moderate, really. So these are the strips that you have to get. Now, what's annoying about this on-call company is that everything comes separately for some bizarre reason. I've had a good meal tonight as well. I had fresh mackerel fillets, and what I did was I just had them in the oven for like 10 minutes or so. I seasoned them not with salt, I seasoned them with anti-inflammatory spices like cinnamon and ginger and so on, and sometimes I put cloves powder in there, and then to top it off I have some raw olive oil, extra virgin olive oil on there as well. Have that cold, not heated up where the chemical changes, and it was a really, really nice meal, to be honest. I had a little bit of cabbage in there, and also some high fat, low carb seafood sauce. So yeah, it was delicious, although I will skin it next time. Yeah. like I say, I'm not an expert at dietary stuff and neither cooking, so I have a lot to learn. But as I learn, hopefully I can help other people who are going through their own journeys like this. I met a woman who, on the way to Clatterbridge today, who unfortunately had breast cancer, and she was going to Countess, and she'd been through chemotherapy and so on. And she was an older lady, not too old though, and she'd had a fairly active life, climbing up mountains and so on. And she didn't know really anything about this ketogenic diet. In fact, to be honest, every time I go to Clatterbridge and I talk to other patients, no one else knows about the ketogenic diet. The only people that seem to know about it are my oncologist and my specialist nurse. And if you go to the cafes around those hospitals, or any hospital to be honest, in the UK, the food in there is just really bad for you, and there's nothing ketogenic in there. I'm basically attacking this cancer from as many angles as I can possibly find. And the rule, if it doesn't give me a direct adverse side effect, then I'll keep doing it. And so I'm doing things like I have aromatherapies during the night. So on my radiator here, I'll have like a little cup of water, and in that I'll have some frankincense oil or some black pepper oil, things like that. Anything where I've read a study where something has some kind of anti-cancer property that I've read from PubMed, then I'll try it out. The more I do this diet, the better I feel as well. I mean, I've never got over flu so quick before, and I feel really good now. I mean, when I was a teenager or in my early 20s or something, if I'd get flu, it would probably last a week or just over. My friend Andrew Scarborough, who got me into all this ketogenic diet, fantastic patient advocate, very knowledgeable dietitian, I think training to be one at Westminster University, and I'm pretty sure he's going to go on to do some amazing things with that. I'll leave it there then, so have a good night, internet. See ya.
Keep on moving, hold your head up high, keep on believing, don't question why. Still get the feeling that something's inside you, still got the magic, it hasn't gone, still got the magic in your heart.